Hello, I'm Dr. Ravi Shankar, consultant nephrologist at Abaya Hospital, Vijayawada. I have been in this field since 15 years, working as a nephrologist in various hospitals and a few transplants also. Yeah, today's topic is, on this occasion of this World Edema Day, I would be talking about edema. So fetal edema and its the pathogenesis, the implications of it, and how to investigate and how to treat it. So fetal edema is actually an accumulation of fluid in the in the extravascular tissues. So accumulation of these fluid in the extravascular tissues is an abnormal thing, and it is symptomatically it can be seen as a pitting skin. So when the fluid accumulates in the feet, and there is a pitting symptom seen. So this the pitting can be various grades depending on how deep the pitting actually happens. It can be ranged from 1 plus to 4 plus. So there are various causes for this fetal edema actually. It's mostly either because of a buildup of the intravascular pressure, which can happen in congestive heart failure or in liver failure also. And the body is unable to eliminate the excess fluid and excess water as happens in chronic kidney disease. And also when the proteins in the body actually starts coming down, like in liver disease and cirrhosis and in nephrotic syndrome, yeah, where there is loss of proteins, and because due to which the oncotic pressure actually falls down and within the vessels falls down, and this leads to the leakage of the fluids into the extravascular compartment. So this reflects as fetal edema. So being a nephrologist, I would more likely to be seeing cases of chronic kidney disease uh, with symptomatic fetal edema and nephrotic syndrome and nephritic syndrome occasionally um, presenting with fetal edema. So in nephrotic syndrome, the fetal edema is mostly because of the loss of proteins, the normal proteins via the urine because of the failure of preservation of the proteins in the glomerulus. So because of the loss of this negative, electrostatic charges in the filtration, glomerular filtration barrier, there's a loss of protein because of which the protein gets leaked into the urine. This leads to a decrease in the oncotic pressure within the vessels, and further on, it shows out as fetal edema. A chronic kidney disease is also a situation where there is the body is unable to remove the excess water and unable to remove the excess sodium, which all accumulates within the blood in the vessels, leading to an increase in the intravascular pressure and reflecting as fetal edema further on. In addition to this renal causes, there are other various non-renal causes which also has to be looked into and which also has to be evaluated. Mostly, the congestive heart failure, the liver failure, and prolonged standing, and there can be even be venous issues like varicose veins or other venous problems. And non-organ causes can also be because of prolonged standing and or thiamine deficiency, where fetal edema can also be seen. Now, what is the major complication which can be seen with some this fetal edema is itself, symptomatically very apprehensive to the patient, and patient feels pathologically wrong within him, and of course, it also states that there is some sort of a harbinger of a disease process happening on, and which has to be evaluated actually. So there are various tests that actually can be done, which are all directed to the various organ systems that are responsible for this fetal edema. So we can look into the cardiac issue, get an ECG and a TG done. Look into the liver problems and get an LFT done. Look into the the albumin levels within the body, and with respect to the kidneys, get an urine analysis done, look for the whether there is any leakage in the urine of the albumins, and get a serum creatinine and the blood urea done. In addition, get an ultrasound abdomen also done to look into the any problems which are there in the abdomen, including the liver, the kidney, and other systems involvement if there is any actually. So how do we go about treating this? The treatments can be by giving diuretics. So diuretics are a mainstay of treatment, and it has been there since ages. So loop diuretics are there, and which actually target the sodium pumps which are there in the loop of Henle, and they prevent the excess accumulation of sodium, and by eliminating the excess sodium, it also removes the water from the body. So diuretics are like the mainstay of treatment for this speed edema. Now, in addition to the directing against the various positive problems that also happen, like if it is the cardiac, then have to target that cardiac problem, liver problem. If it is because of hypoalbuminemia, then you have to replace the proteins. Uh, but by and large, using this loop diuretics, they decrease the edema. So the loop diuretics that has been in existence is long where furosemide, and the problem is furosemide was it lasts for only for the half life of the diuretic is only like 6 to 8 hours. So the diuretics needs to be replaced every 8 hours, and there is this potential problem of diuretic resistance. Further on, now we have another drug, the torsemide. The torsemide actually targets the sodium potassium chloride channels in the loop of Henle and eliminate the excess sodium buildup that's happening within the blood, and thereby decreases the pedal edema. Torsemide is a very good drug available right now. In addition, there are also these gestal diuretics and potassium sparing diuretics like spironolactone, which can be given in addition or in combination with this torsemide to decrease this pedal edema. If there is a nephrotic syndrome, the edema is arising because of the decrease the protein, then the protein has to be replaced by giving IV albumin to the person. So IV albumin in association with diuretics will decrease edema. Problem with edema is it's not just it's restricted to the feet. The edema can extend upwards, and it can even include the abdomen, and can even be seen in the face. The biggest complication with this is when the person has an acute pulmonary edema because of the shift of this edema from the feet into the lungs, so which can be potentially disastrous and life-threatening also. Both oral and intravenous injections of these diuretics go a long way in decreasing the edema. In addition to targeting the various drugs, various organ problems that are there. With respect to kidney disease, if this person is having a decreased urine output, and the ultrasound is also suggestive of chronic kidney disease to a severe extent, then the person will need a dialysis. Um, so if the edema doesn't decrease this, then he may have to be kept on hemodialysis. So it's best to identify this pedal edema initially, and make a thorough investigation of the various causes for the pedal edema, and evaluate the various organ issues, and respectively manage concern problems. Loop diuretics are important therapy for these edema, and that goes a long way. Thank you.